It's an important question for Medicare beneficiaries. Do I need a Medigap plan? Medicare is a crucial part of healthcare for millions of Americans age 65 and over, but it can be confusing and overwhelming to understand exactly what your options are. So in this video, I'm going to break down who needs a Medigap plan, what having a Medigap plan is like compared to just having traditional Medicare or having a Medicare Advantage plan, so that you can determine whether or not you really need a Medigap plan. So stay tuned. First, let's quickly review what a Medigap plan is. So Medigap is also known as Medicare Supplement Insurance. Those two words mean the same thing. And these are plans that are offered by private insurance companies that are designed to work along with traditional Medicare and fill in the gaps, pay the gaps that traditional Medicare just doesn't pay. Medigap plans are differentiated by different letters and they are standardized. So if you buy a Medigap Plan A, that's going to be the same exact benefit plan no matter what insurance company you purchase it from. So a Plan A with Aetna is the same as a Plan A with Blue Cross Blue Shield. And each lettered plan covers a different set of gaps in Medicare. Again, it pays your coinsurance and co-pays for you so that you have less out-of-pocket responsibility if and when you do get sick, go to the doctor and hospital. Now, before I dive into exactly who needs a Medigap plan, I want to first dispel a popular myth when it comes to Medicare supplement insurance, and that is the myth of the Medigap annual open enrollment period. And it's a myth because there isn't one. In most states and in most situations, people only get one opportunity to enroll in a Medigap plan when they are guaranteed to be approved for that coverage without medical underwriting. This one-time Medigap open enrollment period is triggered by your Medicare Part B effective date. So whenever your Medicare Part B medical coverage started, you have up to 6 months from that Part B start date to purchase any Medigap plan you'd like with any insurance company in your area, and you'll always be approved at the preferred rate. But when that window closes, in most states, the insurance company can ask you a series of health questions when you go to apply for Medigap insurance. And depending on what they find in your health history or what medications you take, they could just deny your application for coverage altogether. They could deny you, or they could charge you a much higher premium based on your health. Now, I mention this because many people, when they are first turning 65 or first enrolling in Medicare Part B, think, well, I'm really healthy right now. I don't know if I need Medicare supplement insurance. I hardly ever go to the doctor. But then many people are surprised to find that they may or may not qualify for Medicare supplement insurance later on down the road when they are no longer new to Medicare. So with all this being said, who should get a Medigap plan? So if you're someone who wants to keep your healthcare expenses predictable and low, then a Medigap plan might be right for you. If you are someone with high medical spending, right? So you frequently go to the doctor or hospital, you have a history of chronic health conditions, or even if you have a family history of things like cancer or critical illness, then a Medigap or Medicare supplement plan can be a great way to keep your out-of-pocket spending low when it comes to medical spending. People who travel frequently may want a Medigap plan. So whether you're an RVer or you're someone that just likes to travel, maybe you visit your grandkids in a different state, Medigap plans have no networks. They are always accepted by any provider in the USA who accepts traditional Medicare. So if you travel often, especially travel out of state, then a Medigap plan can really give you that peace of mind of knowing that you don't have to worry about which doctors are going to take your plan. People who just want peace of mind when it comes to their medical spending. Medigap plans cover a lot of the out-of-pocket costs that traditional Medicare doesn't. So this means fewer medical bills, fewer hassles, and more predictable expenses. If you really value this type of stability, then a Medigap plan could be perfect for you. Even if you're in really great health now, but you want protection against potential future out-of-pocket costs. People who want minimal involvement in managing their care. If you're looking for a straightforward kind of set it and forget it approach to your health care, then a Medicare supplement plan could be exactly what you're looking for. You just have to worry about paying your monthly premium. You don't have to worry about filing claims. Since traditional Medicare is your primary insurance, it's very unlikely that you would have to go through things like prior authorization or claims denials that you would have to appeal. So this is one way that Medicare supplement plans are perfect for people that don't want to have to worry too much about managing their care. However, not everyone needs or can afford a Medigap plan. So let's talk about who does not need a Medicare supplement plan. If you're in a tight monthly budget, a Medigap plan might not be the right fit for you. These plans do come with a monthly premium in addition to your Medicare Part B premium. In most parts of the country, a Medicare supplement plan will be an additional $100 to $200 a month. Sometimes less, sometimes more, depending on where you live and the type of plan you purchase. This can be a stretch for people who are on a fixed monthly income. Additionally, there are some people that will have other types of health insurance, which will make Medicare supplement insurance unnecessary. So if you qualify for Medicaid, if you are eligible for both Medicare and Medicaid, then you are considered a dual eligible, and you generally don't qualify for Medicare supplement insurance, nor do you need it. If you have other health coverage like a federal or state retiree program, then likely you don't need a Medicare supplement plan. These types of plans typically work along with traditional Medicare and act as a Medicare supplement plan, so you don't need to purchase an additional Medicare supplement plan on top of that. If you have TRICARE for Life, you likely do not need a Medigap plan. TRICARE for Life works in place of a Medicare supplement plan, and while you do need to be enrolled in Medicare, you typically don't need an additional Medicare supplement plan if you already have TRICARE for Life. Finally, if you live in an area where you have very good Medicare Advantage options available to you and the Medicare supplement average premiums are quite high, then you may want to consider a Medicare Advantage plan instead. Some people in certain regions may find that Medicare Advantage plans are more cost effective and a better fit for their needs. Now we'll dive into the pros and cons here in a moment, but just know that you cannot have both a Medicare Advantage plan and a Medicare supplement plan, nor would you ever need to have both. You'll have to choose one or the other when it comes to your Medicare coverage. So some people will say, well, I don't want a Medicare Advantage plan. Let's say I just want traditional Medicare, but I don't want a Medicare supplement plan. What if I just had traditional Medicare alone and nothing else? So I want to break down how traditional Medicare alone compares to traditional Medicare plus a Medigap plan. Traditional Medicare is made up of Medicare Part A, your hospital coverage, and Medicare Part B, your medical coverage. With traditional Medicare, you will pay the Medicare set copays and coinsurance and deductibles for your services, and there is no cap. There is no out-of-pocket maximum on your potential spending. Now, this can lead to high medical costs if you have a major medical event. For example, if you are in the hospital, you're going to pay a $1,676 deductible per 60-day benefit period. So it resets every 60 days, meaning that you could potentially pay that deductible more than once in a year if you are in the hospital more than once. Additionally, you'll have pretty high copays associated with a long hospital stay and with skilled nursing facility care. And under Medicare Part B, you're responsible for 20% of the cost of your medical services. And again, there's no cap on that. So if you get hit with cancer and you have to pay 20% of the cost of your Part B services, which includes chemotherapy, radiation, infusions, 20% of the cost of those medical bills can be very catastrophic to a senior on a fixed income. You don't have any additional form of coverage. So if you have traditional Medicare and Medigap insurance, then you do have very comprehensive coverage with very little out-of-pocket responsibility. So for example, I'm going to take Plan G, which is right now the most popular Medicare supplement plan. If you have traditional Medicare and a Medigap Plan G, you just pay a $257 per year deductible, and then everything else is covered at 100%. So any type of hospital stay, cancer treatment, skilled nursing facility care, chemotherapy, etc., would all be fully covered by that Plan G after you've paid your $257 Medicare Part B deductible. So again, Medigap plans are very comprehensive and excellent coverage if you can afford the extra monthly premium that comes along with them. Now, I want to talk a little bit about Medicare Advantage plans, also known as Part C, and how having a Medicare Advantage plan would compare to having a Medigap plan with traditional Medicare. So Medicare Advantage plans are managed care plans. They're offered by private insurance companies. They typically roll the benefits of Part A, hospital coverage, Part B, medical coverage, and usually Part D, prescription drug coverage, into an all-in-one managed care plan. Think like an HMO or a PPO type of plan. Essentially, these Medicare Advantage plans replace your original Medicare benefits, even though you still have to remain enrolled in original Medicare to be on a Medicare Advantage plan. Now, when you go to the doctor and hospital, you show your Medicare Advantage plan card. The doctor and hospital bills your plan instead of billing Medicare. So Medicare Advantage plans often come with lower monthly premiums, usually $0 a month premium in most parts of the country. But there are network restrictions with these plans, meaning that you'll have to generally see the doctors and hospitals that have contracted with that plan, and doctors can come in and out of network throughout the year. Additionally, you'll pay set co-payments and co-insurance for certain services, kind of pay as you go type of medical plan. And many of these plans offer additional perks like dental or vision or hearing benefits. Things that are not covered by original Medicare are often rolled into a Part C Medicare Advantage plan. So unlike a Medigap plan, which just works with traditional Medicare and fills in the gaps and pays what traditional Medicare doesn't pay, Medicare Advantage plans are a managed care plan. And while the monthly premium cost is typically lower on a Medicare Advantage plan, your out-of-pocket costs for your medical services is a bit more unpredictable, right? Because you're going to have to pay set co-pays and co-insurance whenever you are using the plan generally. Also, the data has shown that Medicare Advantage plans are more likely to deny care or require prior authorizations for care compared to traditional Medicare. So why would you choose one versus the other? Well, Medicare Advantage plans, I think, can be a really good fit for people in certain parts of the country where there are a robust number of Medicare Advantage plans with very comprehensive benefits available. And they're great for people that need a low monthly premium and who don't use the plan very often, who don't go to the doctor and hospital. Medicare Supplement or Medigap plans are usually a better fit for people who want more flexibility. They want to be able to see the doctors they want to see, they want to be able to travel with their plan, and they want more predictability, right? So they'd rather pay a set monthly premium but not have to worry about an unexpected high medical bill. There is no one-size-fits-all plan that is going to be the best for everyone. So the plan that will be the best for you is really going to be based off of your needs, your budget, where you live, and other factors. I think that it is extremely important to get educated on all of your different options and really to talk to an independent broker, one that works with both Medicare Advantage and Medicare Supplement plans, so that you can determine which type of Medigap plan or Medicare Advantage plan is going to be the best fit for you. If you decide that you do want a Medigap plan, there are many different options available, different plan letters, different insurance companies that you can buy these plans from. And like I mentioned before, the choice you make when you are new to Medicare is the most important, because after that one-time Medigap open enrollment window closes, in most states, you may not be able to switch to a different Medigap plan later on without having to pass through that medical underwriting process. So of course, this is where we can help. My team and I work with both Medicare Advantage plans and Medicare Supplement plans, Medigap plans. We are licensed in 48 states. We work with over 30 different insurance companies, and we have helped tens of thousands of clients find the best plan for their needs. So we would love the opportunity to assist you. Please feel free to give us a call at any time. You can leave all of the questions and comments that you have for me below. I love to hear what you have to say. Thanks so much for watching, and we'll see you soon.
My mom, she always helps me because she's a really smart girl. So I'm filming today, and when you film, be perfect. Because I don't want you to mess up. Because your heart is your desire, and it beeps really loud. Well, sometimes you don't hear it. So that's what you need to learn from me. Bye. comments. Spider-Man.